Hi, welcome back to the channel. This is Dr. Walker again from Denwalker.com. So I'm going to call this my Rant and Rave Sunday video because, you know, all many days during the week, all you hear about is sort of um, the Delta variant, people dying from the virus, um, people dying after their shots, and it does make a difference which shot is happening, and then they'll do an investigation, and obviously the vaccine is not the reason that people are dying. Um, there is other things that people are dying from other than, there's a 13-year-old kid, a 15-year-old kid um, that I read about this past week, um, uh, a 60-year-old gentleman. Again, just a whole list of things, and it's, it'll happen. We'll say, oh my God, some person's, dying from COVID or the vaccine, and then they'll do their investigation. It comes back to be, oh, not the vaccine. The vaccine's completely fine. But I thought about, everyone, and I'm really surprised, really am surprised about the amount of data that I see on YouTube regarding um, physicians advocating for the vaccine. And again, fine, but and many of them are sort of countering things like natural immunity. So in other words, if you've had the COVID already, the chance of you getting COVID again is no different than having the vaccine, one, and two, in fact, and probably less likely that you have a COVID a second time, and that your immunity is long lasting beyond a year. And some people think this is going to go on in T cell and B cell immunity for decades, likely, right? That's what you're hearing. But when you watch them on YouTube, it's the vaccine's so much better. The vaccine is right, and I'm just surprised. My personal take on this is, at least in my facility, of the people that I know, providers that I know, less than half of the physicians um, are vaccinated. Less than half of them are vaccinated, and there are lots of reasons why. But that should tell you something. That should tell people something. Physicians are saying, okay, but you get on YouTube and there's so many people, physicians, that's from big centers, and they're sort of advocating for, forget natural immunity, vaccine. Um, but so that whole thing bothers me, and it bothers me also how many physicians I know are being, quote, silenced um, by different entities, if you would, because when they want to say what they have to say, then it's maybe this video as well. It's going to be, banned. I've been sort of banned from Twitter at least twice in the last couple of weeks for just trying to forward articles to people. And again, it's not telling people to take vaccine or not take vaccine. It's just forwarding people information to say, before you take your vaccine, consider these entities. That's all I'm trying to say. Just consider these other things. Yet I'm being censored and banned, and sure, fine. But when you stop and really think about it, the U.S. right now has 609,000 people dead from COVID. The U.S. is either top of the list or second on the list in terms of number of vaccines. I think we're only behind China. China has like a billion doses infused. The U.S. is sort of right behind them in terms of the number that we have. But that's what you hear about. You hear about sort of number dead in India, number dead in China, number dead in U.S. Right? You're hearing all of that, but then there are other places, other remarkable places, and I just don't know that we're doing enough digging to figure out why that is. Places like Haiti, for example. Haiti has been doing their thing now for a year. They've been open, schools are open, business are open, no masks, nothing. They've just been doing their thing. Places like American Samoa, right? I saw one article that talked about 2 people dead in American Samoa from COVID-19. But if you Google it yourself, lots of places that they're either very few people dead from COVID, or like no one dead from COVID. And it's like, why is that? Why is that happening? Why are we not talking about those countries? What are they doing? What is Finland, for example, doing? Finland is like 950 people dead. Haiti's like 250 dead. American Samoa, maybe one or two people that's dead from COVID-19. We're not talking to or listening to anything that those folks are doing. I don't know. I don't know fully why that is. Why are we not talking about those places? How are they able to protect their citizens from COVID-19, and we are not? Right? We are not. We're still vaccinating everyone, as much people as we can. We're talking about going from door to door infusing vaccine. We're not talking about what people are doing in other countries to protect themselves from COVID-19. We're not talking about any other alternative. As people are sort of making their minds up again about the vaccine, what other things, what other options are they able? Is ivermectin a possibility? Is vitamin D a possibility? Is vitamin C a possibility? Is elderberry is anything else a possibility other than just the vaccine? And I just don't know. We're having enough dialogue about that. Every time you turn the TV on or the news channel, it's talk. And again, vaccines can be beneficial. Vaccines can be useful. I fully get that, but people are not fully sold on the current vaccines available to us. When you hear about all these folks, never having a problem before, now they're dead, and what's the cause of that? And I do get it. I do get that a certain amount of people that has anything. You get a brand new drug, you get a brand new antibiotic, you get whatever you have that's brand new. Some person across the world is going to succumb to it because that's just their body, and I get that. But when I get the feeling as though we're saying it is impossible, quote, for this vaccine to cause any of these problems in any of these people, I kind of worry about it. I do. It's safe, and I get that. That's what folks are saying, but it's safe if you are not the family affected by, right, by the issue. There are people online you can see that has new tremors, and these are like life limiting tremors that they have, which they did not have before. Kids dying, kids with myocarditis, kids with pericarditis, kids with fluid around the heart. Um, all of these things are happening, but we sort of downplay them and say, it's not possible from this and it's not possible from that. I just don't. I just rather people would just be forthright and say, okay, well, yes, we expect a certain amount of people are going to whatever. Talk with your doctor. Look at your own personal profile. Look at your risks, and say to yourself, well, is this vaccine important for you? I heard one of our providers at the beginning of this thing said, yeah, if he's got a person who's end stage COPD, walking around with an O2 tank, can't breathe otherwise, if that person gets COVID, then yes, their chances of succumbing to the disease is probably pretty high. That's what I fully understand that. But why aren't the doctors sort of weighing in more, just again looking at the person's entire profile and saying to themselves, is this something that you should take or not? So in other words, is your risk high enough for dying from COVID, or are there things that you can take to supplement your personal health to offset perhaps a vaccine, at least for now? But there is no such discussion. I've been in medicine 20 plus years, and I've never ever seen a drug or vaccine that there was no contraindication to, except to the drug itself. I've never seen that. I've never seen, close your eyes and every person can get this drug regardless of their medical background, regardless of their history, regardless of anything. I've never ever seen that, and it just bothers me. My daughter is in med school currently, and her program is talking about mandating the vaccine for all the students, which it pains me to say, but she mentioned that she may stop for now because she is opting at this point not to have the vaccine because, again, in her mind and in my mind, her risk is low. Her risk for anything is low. And I implied it in a previous video. Back in March of 2021, I read an article that said essentially that people across the country that they've tested, about half the people that they've tested had been exposed to COVID in the recent past. And those individuals had T and B cell immunity still. They then coupled that with, and fast forward then to June, to say now that we in the U.S. specifically have had so many people quote vaccinated, that herd immunity should be around 92%. Again, based on people with natural immunity, coupled now with people who've had the vaccine, we should be upwards of 92% herd immunity. When this whole thing started, we said, well, maybe 75 or 80% of the people need to be vaccinated to get herd immunity. Now I've heard the gentleman from Pfizer said recently that none of us are safe until all of us are safe, and all of us are safe mean all of us have been vaccinated. I'm not certain that's the answer. These are not physicians. They have not been trained in medicine. They have not been trained in medicine. And so when I have people who are non-medical folks, and some medical folks too, non-medical folks saying to me that the only way that you can open your businesses up, the only way you can travel, the only way you can go out to dinner, the only way you can stop socially distance, the only way you can stop wearing your face mask, the only way you can stop washing your hands, the only thing that you can do going forward is by having a vaccine. That bothers me. Thanks for listening.